Surgical and radiofrequency ablations for drug refractory inappropriate sinus tachycardia have been hitherto not very satisfactory, though various approaches have been tried. Sinus node sparing hybrid thoracoscopic ablation was described as a novel approach in 2019 for both IST and postural orthostatic tachycardia. Video-assisted thoracoscopic ablation was performed through 5 ports on the right side. Sinus node was identified with concomitant endocardial 3D mapping. A radiofrequency bipolar clamp was utilized for isolation of both superior and inferior vena cava, and a crista terminalis line was made with sparing of sinus node. All lines were interconnected. Of the 50 patients in that seminal study, 39 had IST and 11 had POTS. All patients had stable sinus rhythm after 6 months blanking period with complete resolution of symptoms. At a mean follow-up period of 28.4 months, normal sinus node function and chronotropic response to exercise was noted. Pericarditis was the commonest complication, which occurred in 39 patients with complete resolution in all cases. After the promising results of the initial report, a prospective multi-center registry compared sinus node sparing hybrid ablation with radiofrequency sinus node modification. There were 50 patients in each group with a mean age of 22.8 years. The hybrid procedure was done as described in the previous study. Radiofrequency sinus node modification was done by endocardial and/or epicardial mapping and ablation at the site of earliest atrial activation. Normal sinus rhythm and rate was restored in all patients in the hybrid group and 84% of the sinus node modification group. Hybrid ablation had better improvement in mean daily heart rate and peak 6-minute walk heart rate compared with sinus node modification. Redo procedures were needed in all the sinus node modification group compared to 8% in the hybrid group. Phrenic nerve injury occurred in 14% of the sinus node modification group, but none in the hybrid ablation group. Acute pericarditis occurred in 92% of the sinus node modification group and 48% of the hybrid ablation group. Permanent pacemaker implantation was needed in half of the sinus node ablation group and 4% of the hybrid ablation group. Another multi-center experience of 255 patients had been reported in 2021. Like the initial study, that study also included patients with IST and POTS. It had included 204 cases of drug-resistant IST and 51 cases of POTS. Procedure was hybrid ablation as described initially. Mean age of patients was 25.94 years in that study, and all underwent sinus node sparing hybrid thoracoscopic ablation. All patients had stable sinus rhythm at the end of the procedure and discontinued medications during follow-up. At a mean follow-up of about 4 years, normal chronotropic response to exercise was present. Pericarditis was the commonest complication noted in 47% with complete resolution. 5 patients required dual-chamber pacemaker for sinus arrest lasting more than 5 seconds. Overall, the results of sinus node sparing hybrid thoracoscopic ablation for inappropriate sinus tachycardia appears promising. As of now, we have only non-randomized study data. We need randomized control trials before a firm recommendation can be made on this novel treatment option. Still, it is likely to be considered as a viable option for drug refractory IST if other studies document the good results which are sustainable in the long term. Thank you for watching this video. Please subscribe, like, share and post your valuable comment below this video.